Here is Abrar Quader from Compassionate Care Network.
Madam President, Commissioners, my name is Abrar Quader, and I represent a healthcare nonprofit called Compassionate Care Network, which is a member of the Healthy Cook County Communities Coalition. I stand here today to speak on behalf of the thousands of uninsured Cook County residents who don't have access to health care and to support the proposed ordinance 16-4392 for a countywide direct health access program. A direct access program within Cook County is not unprecedented. In fact, my organization, the Compassionate Care Network, has over 200 primary care and specialist physicians that have been providing a healthcare network access very similar to the program envisioned in today's proposed ordinance for over 15 years in several underserved communities of Cook County, providing a medical home with integrated care, culturally competent care, and preventive care to thousands of uninsured. And we have seen through our network model the transformative impact on health disparities and health equity that having a direct access program can have, particularly in at-risk communities. Many of the components of the direct access program proposed in today's ordinance have already been shown to be successful in reducing health disparities by the work piloted by Compassionate Care Network, such as the concept of a medical home where patients can regularly engage in primary and preventive care, a network of specialized care coordination, community health workers to help connect underserved populations to health resources in a culturally competent way, cost reductions, cost controls, and membership cards. Our experience tells us that the direct access program proposed in today's ordinance will absolutely reduce health disparities in Cook County across all communities. Like the vast majority of uninsured, many of the patients that we see have dangerously high levels of hypertension, diabetes, obesity, and heart disease. These four chronic conditions alone count for the majority of healthcare costs, both in lives and in money, and can result in premature death if left undiagnosed and untreated. By creating a county-wide direct access program for all uninsured, we will be able to foster a culture shift where patients begin to have a proactive relationship with their primary care providers, encouraging prevention and screening and catching diseases before they advance into critical stages. Positive health interventions like the direct access program being proposed today will result in healthier communities. From an epidemiological standpoint, healthy communities tend to spread health. Every day, Compassionate Care Network assists patients who are on the brink of a medical catastrophe, but who have never before set foot in a doctor's office or who end up in the emergency room instead of seeing a primary care physician. These most vulnerable residents of Cook County are our neighbors, our friends, our co-workers, and members of our own families. The only difference is that when they get sick without a direct access program, they have nowhere to turn for help. With today's ordinance, Cook County has the opportunity to be a national leader in the movement for greater health equity. Thank you for your time.
Thank you.